So I'm coming on with my husky voice now and a dodgy microphone, but hello, my name is Carol, and I want to introduce the next session, which will be Rob Webster, who's coming to us to talk about Co-Producing Leeds and the STP, the Sustainable Transformation Plan, and Becky Malby from London South Bank University. And what we really feel that, I can see Rob in the picture now, we really think that it's important that as we look forward to the Sustainable Transformation Plans, they need to represent co-production at all levels. And we wanted to have an open discussion about this because it's a topic that's really hitting the news at the moment, because we've put on the resources the Sustainable Transformation Plans for quite a few of the footprints, so we thought it would be really useful. So apparently we're trending on Twitter now, so if you want to look at that, and I'll hand over to Rob Webster, who's going to lead off for the first session.
Thanks very much, Carol, and as you can see, hello, my name is Rob Webster. I'm the Chief Executive of South West Yorkshire Partnership NHS Foundation Trust, which is a healthcare provider in the north of England. We deliver a whole range of services from prevention, well-being, physical and mental community-based services, right through to forensic mental health and learning disability care. We have a population of about 1.2 million people that we cover, and we also deliver about 1 million contacts a year to people. I always say that we deliver care from birth to death, from head to toe and inside and out. As well as being the Trust Chief Executive, I'm the lead Chief Executive for something called the Sustainability and Transformation Plan, and I'm going to give a bit of a brief around where that's going, what sort of things that it says, why this agenda is really important to the success of the STP. And Becky Malby, who I've known for over a decade, is going to talk about some of her experiences as an expert in co-production, and we'll probably tell a few stories along the way. Hopefully everybody can hear and see me all right. If you can't, then please let us know. In terms of the STP itself, then I think that what you'll get if you live in the UK, if you join us from the UK, is there's a lot of noise at the moment about sustainability and transformation planning. What we hear a lot about is hospitals and the fear that people believe that the STP process itself is about closing hospitals or consolidating acute hospitals. And what I would say to them is that that isn't what the purpose of the Sustainability and Transformation Plan process is at all. As the leader of the STP process in West Yorkshire and Harrogate, what I know is that I'm leading a group of chief executives across the health system, local government, the third sector and elsewhere to think about how we deliver sustainable services in health and care for the next 5 years based on places. And that's a fundamental shift in a couple of ways. It's material for the conversation today. The first shift is that I haven't got an organisation that's called the STP. You can't go and visit the headquarters. There are no staff in it. What we've got is a network of leaders operating in a system, trying to bring their resources together to make sure that we can deliver safe and sustainable services for the future. Now, that's different from a hierarchical approach to leadership and management, which has been really prevalent in the NHS, particularly over the last 15 to 20 years. The second big shift, I think, is that this is about place and it's about the medium term. In the NHS, we've been having a system which is designed around organisations which are individually regulated to look at finance and quality. And in the policy, at least, all of the relationships have been between the regulator and the institution. Now, I think we know that that is a redundant operating model, and what we need is to focus on the system and the place, and we need to do that over time. We can't go from year to year, hand-to-hand combat on what the regulator thinks between itself and an organisation, or what an individual commissioner might think with an individual provider. Those days are over. So if you think about the STP as a way in which a group of leaders are working to ensure that services are sustainable in a place over the medium term, then ask yourself the question, what's the alternative? You quickly come up with the answer, well, there isn't one. What we've got to do is make that work. And in doing that, we can build on the policy direction set by the 5-year forward view. And in that, it quite rightly said, there are 3 fundamental issues that we have to tackle, 3 gaps that persist in health and care. And they are that, where you live will determine how long you'll live and how well you'll be, and that health inequalities persist. So people are healthier in some places than others, and we need to try and address that. The second gap is that care varies in an unwarranted way. We have quality variations which shouldn't happen that we need to address. And then the third gap is the one that people talk about mostly and obsess about, which is the money. If we continue to deliver care in the same way as we do today and look at the demands that we will face if we don't do anything about them, in West Yorkshire and Harrogate over the next 5 years, then we'll be about £1 billion short of where we need to be in terms of resourcing. So the STP, a place-based plan based on network leadership, based on sorting out health inequalities, based on sorting out care and care variation, and trying to do that by living within our means. And if you read our STP, which you can because it's published, it's online, the submission's available, an easy-read version's available, we're making it as accessible as we can. It's quite a long document, and there are lots of annexes available, but it has quite a simple story at its heart. What it says is, we want places to be healthy, and that means that you get the best start in life, you live well, and you age well. If you have a long-term condition, then we'll support you to look after yourself, and we'll do that through technology, and we'll do that through peer support. If you have several things wrong with you, then we'll create a team which has you in it, your family in it, your carers in it, the third sector in it, social care in it, and the NHS, working together. And crucially, we will focus on the outcomes that matter to you. When you get sick, which you will do, you can go to a small local hospital, which is networked with others to be sustainable. But sometimes the nature of your illness will mean you have to go further away to a centre of excellence. That centre of excellence will be world class, it will save your life and your outcomes will be better. All of that will be bought, designed, commissioned once by local government and the NHS working together to spend the West Yorkshire pound wisely. And the engagement with the public on the design, the delivery and the assessment of those services will be fundamentally better than it is today. So all of that is what the STP aims to do, and in our STP we've taken a subsidiarity principle, which is that everything gets dealt with as close to the problem as possible, which means locally as possible, either in a practice, in a cluster of practices, in a place which is recognisable to local people, in a local authority, or across West Yorkshire and Harrogate. And the vast majority of work isn't done at West Yorkshire and Harrogate level, it's done at a local level. Now all of this is really fertile ground for co-production and asset-based development. If we want to think about how that's worked over time, then we're going to tell 2 stories today, I think, about something that happens in my current organisation, which is relevant, and an approach which Becky's had in the past to co-producing Leeds, which again I was involved in at the time, and is actually one of the best examples I can think of co-production in action with lasting changes that have fundamentally made a difference to people everywhere. Before we do that, Becky and I thought it might be useful to see if there were any questions or comments about the STP. And if people want to put their hand up or flag about that now, then please do. And Carol might give us a hand with this element if it starts to get very busy. So whilst we do that, is there anything that Becky, I'll pass it over to Becky for a second to see if there's anything that she wants to add at this point. Becky's now the presenter.
Hi Rob. If you're looking for feedback from the chat, we've got Dominic online who's been monitoring that for you, so he'll be able to give you some feedback if you'd like.
Great stuff, yeah.
Hi, good afternoon, everybody. Just picking up on some of the comments that have been discussed around, I think, some of the language around co-production, and there's some comments around actually, in terms of the STPs, making sure that we have a way to make sure that we don't have any health inequality, and how are we going about that? It's kind of I think it's an open-ended question, really.
Okay, great stuff. Becky's currently the presenter. I don't know if Becky wants to say anything before I pick up on some of those comments.
Hi, sorry, I was muted. It's a very bad position for me to be in. As everybody knows, I like to talk. I think when I was watching, I was doing some of the chat whilst you were talking, Rob, and I think there's a real concern that the language of co-production gets watered down. So, you know, two chief execs having a chat as a co-production. So how do we protect the notion of co-production and how that's different from, you know, engaging citizens in all sorts of other things? So just having if you've got a view about that, Rob, I think that was quite a useful comment back from the chat too.
Okay. John, to hand it back to me then as the presenter.
You're on. Go ahead.
Have you done it?
Yep.
It's not showing up on my screen. You're still the presenter.
I can hear you.
You have to do it on the, you have to see the little blob next to the BN.
Why don't you answer those questions, and then we'll get Ollie to move the slides if we're struggling with that.
Ollie, can everybody else hear me at the moment?
I think so.
Hi Rob, it's Helen. We can hear you absolutely loud and clear. And Rob, you've got presenters' rights again.
Great stuff. Thank you very much. So there were a couple of questions there which I think are really excellent. The first was how do we deal with health inequalities? And given that the inverse care law exists, so that people who need the most help get the least, is still a factor in our system. And given that you could all think of the places where social deprivation, health deprivation are driving health inequalities in the place where you live, and they probably haven't changed for a while, then this is a question, I think, for the whole sector, which goes beyond the NHS and much beyond the NHS, which is why having a sustainability and transformation plan which is embraced by local government and the third sector is an essential component, because your housing, your education, your employment, your access to green space, the environment will help to drive improvements in health inequalities. Then the secondary prevention agenda that we have, so knowing people who are sick already, who may not be getting any help or are getting poor help, targeting those through reform general practice, and the real priority on obesity, alcohol and smoking, still the three biggest determinants, or the three biggest lifestyle determinants of ill health, are all factors that we've got as part of our STP. We need to think of novel ways of doing that. I was always struck in the past, when I was a chief executive in Calderdale, the people who needed a relationship with the healthcare system didn't have one. What they did have was a really great relationship with their landlord, and their landlord was the housing association. So the way that we looked at tackling mental health issues, smoking and other lifestyle issues was by developing peer supporters with the housing association, with people who found it very difficult to access healthcare. And it's those sorts of innovative approaches which I think need to be at the heart of the STP. So an STP can tackle health inequalities when it's all the partners thinking about working with people to build their assets in communities using places that exist already. And that's certainly the case that we want to bring to it. In terms of co-production not being about me and my mates talking to each other and calling it co-production, I think that's a really good question. And if I may, what I suggest is when we get into the Co-Producing Leeds story, I think Becky can talk about how we really flattened the hierarchies in that role to the point which was quite detrimental, I think, to some of us in terms of some of the feedback that we had, but was brilliant in terms of genuinely bringing out some fantastic ideas and really making a difference. So what I'm going to talk about now, I think, is our approach to creative minds, and then I'm going to hand over to Becky to talk about co-producing leads. So as an organisation, I'm going to hand over to Becky to talk about voice choice and co-production. Sorry, I'm getting ahead of myself. But Helen, Becky's got some nice material to talk about here in terms of the theory of where we are, which I think will really illuminate the next conversation.
So good to see so many people in the chat. I think we're up to 111, which is just fantastic, and I'm just keeping an eye on the chat as it goes. So I'm not looking at the rest of the screen. So one of the things that really struck me from the chat, and I think strikes me across the NHS, is how unrigorous we are about our relationships. So Rob's a fantastic example about how you have open, honest, and collaborative relationships across the field. But co-production is about co-discovering the problem, co-designing the solution, co-delivering the answer to the solution, and co-evaluating whether it works. And that's very different from other ways we engage citizens. So people seem to think that engagement means co-production, or engagement means I don't know what. And so we've done just our way of categorising the sorts of relationships we're going to have with citizens, with people in the system, because we think there are three main ways of working with citizens as partners in health and social care: voice, choice, and co-production. And I'm just going to move on to the. Could you move me on to the next slide? I don't seem to be able to do that. Just pop on the next slide. Thanks. So there's two ways that we give citizens voice. One is where it is entirely our responsibility. So when we're thinking about some pathways of care, where there is a clinician decision that is absolutely evidence and expert based, we might ask for some feedback about how well we've done in relation to that. So where the issue is entirely the responsibility of the profession, not the responsibility of citizens on their own or a partnership, then we have to generate some feedback about how well have we done as professionals. So that's one issue. So this is not, I'm not talking about about you being a patient voice. It's about people having voice. So there are three different relationships. This is a relationship where we ask for a voice in the system. So that's the first one. Second one, please. If you just move the slide along. There we go, I've done it. Okay, voice as owners. So the second one is where citizens, where people own the NHS and we are accountable to those people. So they have a voice in strategy and they have a voice in the future, and they have a say, is probably a better language, have a say about what happens. So it's slightly different in that in this one, we're saying that we're accountable to you as our community, you pay your taxes, you are our shareholders, and therefore you have the final say on how it goes. So that's the second one. So, and those two, we get those completely muddled, but we certainly don't tend to use this second one as a catalyst for change. I've seen the watering down of citizens as owners of the NHS. So it sort of bubbles up every time there's a reorganisation. Rob's trying to make that part of the STP this time round. If you saw the NHS, when we first set up NHS Trust and we're going to have members, etc., it was very prevalent at that stage. But again, at CCGs, it's prevalent, but it's disappeared again. So we don't really like our communities as our owners, and that's quite different. So that's the second one. Third one, so there's two types of voice. Third one is some people see citizens and people who use services as consumers or clients. And this is where people have choice, so a choice of services, whether you want to choose a particular service that you want to attend, or whether you want to choose a particular clinician you want to work with, or whether you want to choose to self-care versus be directed in care. So that's the third one. And it's not one that I'm very fond of, as many of you will know. But it is in a consumer-led, this was a Tony Blair-led NHS, there was a sense that we had to have a better customer service. So that's the third one. And then there's the fourth one, which is co-production. And this is the one which is very different. This is where both parties, both health professionals and managers, citizens and people are assets in the whole. That it's not about somebody having more expertise than others. It's a level of equality. It absolutely reiterates around personalised services, and there's a total independency. So that's it's just trying to recognise that when we're talking about how we engage with the public, the public plays multiple different roles, and at some points we're completely partners. We're absolutely in it together. We're absolutely equal, and we're trying to do something together that couldn't be done separately or differently in isolation. And there are times where the responsibility is the health service professionals to deliver, and we're asking people to give feedback. There are times when we're accountable, and there are times when citizens have choices. And it's recognising that those distinctions sometimes helps people understand how they're going to organise their services and how they're going to organise their relationships. So Rob might be getting feedback and then a sort of consultation on the STP, but he might be co-producing the strategy, and those are different types of relationships, and people don't always want to do all of those at once. So when we're thinking about co-production, these are the 4 stages. You firstly have to identify and understand the problem. So what often happens is the health system owns the problem. They come up with the problem, and they go out to citizens and say, this is our problem, and we think it's yours too, and we want to co-produce the solution. And that is not where you start. And we're going to tell you some stories about how we've done that. So I'm going to give you a little background to Creative Minds, and then Rob's going to tell you a little bit more about it. So where we started with South West Yorkshire Partnerships Trust, which was many years ago now, was around the point at which the Partnerships Trust was taking over, merging with, had won the services for Barnsley. And the chief exec at the time was concerned about how those two cultures would merge. And that was the NHS problem. But that isn't the problem. When we started working with local people who were users and carers related to this service, that wasn't the problem that they came up with. What they came up with was the fact that the health service was working in isolation from the community. And they said, actually, the problem here is not about how we merge two different cultures. The problem is that we haven't worked out how we're going to be together to improve people's health and well-being together. That was a better problem. So we started with that as what's the generative, the causal issue here. So we didn't pick the NHS's problem. We said, what's these underlying issues? And from those underlying issues, we decided that we'd try and step into each other's shoes. So what we found was that if you're thinking about health and social care in relation, and that point to primarily mental health issues, what was the system for that question? Well, that was a lot of citizens and carers, but it was also third sectors as well as the Partnerships Trust. And we got those folks in the room. Now, in my view, for it to be full co-production, you have to have 50% of the people in the room have to come from the community. They have to be people who use the services, they have to be people who care for people who use the services, and they have to be people who own the services, so taxpayers. That's my view. I haven't ever found it work with less than that, so we did it with that level. And we got those folks in the room. We had about 70 folks, half of which were commissioners and providers and NGOs, third sectors, and half of which were citizens. And we spent time trying to investigate what was going on in this system, i.e. the health and social care system in relation to mental health services in South West Yorkshire. What we generated was some energy for change together. And so that group came up with ideas for change. And they did that by stepping into each other's shoes, going to go and see really great examples in their own communities. And they prototyped a number of things that they were going to change together. And went to the board, and we had a non-executive of the board attached to each of those change ideas so that they could at least see how it fitted in with the strategy of the organisation, could perhaps be a champion for it at the board, and agreed that we were going to go with these 10 prototypes, one of which was Creative Minds, another one, as it happens, was the museum, Rob. A year later, and now years later, did it work, and co-evaluating whether it worked. Rob's going to just tell you the story about Creative Minds and what's going on in the Trust now.
Great stuff. Do you want to hand back to me
Yeah,
then?
you're on.
To be the presenter. Great stuff. So thanks for that, Becky. As Becky said, I inherited Creative Minds, and I'm really glad that I did. It's a linked charity now to our trust. It's hosted by the trust, and it delivers support across a range of issues in all 4 of the places where we operate, in terms of Barnsley, Calderdale, Kirklees and Wakefield. And the kind of things that we do, for example, one of my favourites, I think, is in Barnsley, where the germ of this originated. It's called Theratops, where mums and dads and carers with children under 2.5 who've got complex physical needs come together to do creative therapy, funded by Creative Minds but supported by the Trust's therapists. And what you get from Theratops is that you get a safe space to be with people like you, to build your confidence and improve your mental health around the stresses and pressures that you've got as a new parent or a parent with a child with multiple needs, and you have great fun. And the outcomes for that group are fantastic in terms of the confidence of the parents, the improvements for the therapists seeing the kids, and the approach that's being taken, which replaced one which was about individual therapy in individual homes, where people might actually feel a bit isolated because they were different. Similar other types of things, so we don't just cover that sort of creative therapy. We've got projects which cover sport and leisure. In a couple of weeks I'll be playing for the Good Mood League in one of the teams there. That's a league for people with mental health problems who may also involve people who have profound mental health problems. And I'm really looking forward to playing in that league, which tries to normalise things for people, create an environment where people doing something which we all enjoy, and also create, again, a context where people with similar sorts of issues can come together to build their own assets and their own creativity. So I could talk a lot about Creative Minds in terms of the types of things that we do, but the important thing is that the impact that we see on people is something which is part of our strategy. If you go back to the STP and the fact that it says places should be healthy, you should have a good start in life, you should live well, you should age well. If you've got a long-term condition, you should be supported through peers and technology to keep you well. And if you need significant support, we will put a team around you. Well, that's what my organisation tries to do. And I've inherited an organisation, and frankly, it's one of the reasons I wanted to be the chief executive, where I've got more than the usual tools to play with. I've got a set of linked organisations to co-produce solutions to the problems that face us in getting from where we are today to delivering that vision that's in the STP. And if you looked at something like mental health services, what we can now do is say that we give you an offer that, if you look out the window where I'm sitting today, you can see the fences and the barbed wire and the gardens and the facilities available in our forensic lock services. We can, as a trust, offer that intensity of support to people at that time in their life, and that becomes their community. And within those units, behind those fences, they get access to Creative Minds. So our Newton Lodge services have had a co-produced, co-developed Lodge Fest every year, which is a festival of sport and creativity and arts, which helps people to feel part of something which is not just about being held within a mental health hospital. And that extends into our locked environments, our informal environments, and out into the community mental health teams. Even better than that, though, what we're saying is there's a significant level of support that you can get through Creative Minds and through our recovery college infrastructure. We have 4 recovery colleges, 1 in each of the areas that we serve. You can have access to those things to keep you well, to keep you mentally well, to keep you physically well, and to keep you connected. And the work of Creative Minds and the work of the recovery colleges is going to be a fundamental part of the way in which we respond to and deliver the vision that's in the STP. Because rather than seeing Creative Minds, recovery colleges, altogether better, some of our innovative services as some kind of optional extra, they become part of what we do, and by becoming part of what we do, they infect what we do. I've got no doubts that the staff working in Newton Lodge in our locked environments are thinking very differently about the way in which they support people within those environments as a result of working with the service users themselves, the charities and bodies behind Creative Minds, and seeing the difference that it makes to people every day. And we extend that right out into our communities. So our recovery colleges, where you go to study and get a qualification, and therapy sort of happens along the way, have demonstrated that on a good day, they'll reduce community mental health team utilisation by 2/3, and on a bad day, it'll be 1/3. In an environment where we have to do things that are better, simpler, more cost-effective, then that's a really fantastic example, I think, which will fundamentally make a difference to the organisation. Now, I'll be lying or misleading you to say that that's the way everybody sees our strategy, and it's there, it's working, it's fundamentally in place. It's not. We've got a long way to go yet, but if you look at the kind of range of offers, then there's a great opportunity for us to turn Creative Minds into the way we do things around here, or part of the way we do things around here, and co-production in the way that Becky's described to be a part of that. The final thing I'd say in this bit is that that's what we're doing as part of our strategy refresh. By December, this organisation will be publicly saying how it's going to go forward to deal with the challenges that it faces. That strategy is being co-produced with people, whether they're members of our foundation trust, members of staff, service users, or our stakeholders. And what it will do is allow us to build on the issues that we face today and the solutions that we've got. Ones that make a huge difference. I think I'll finish with this bit on Creative Minds. So 2 weeks ago, it was our Excellence Awards in the Trust. We like to celebrate success and say thank you to the staff and our partners. The Outstanding Achievement Award was won by one of the lay tutors from Creative Minds, a fantastic woman called Debs Taylor. And she talked about how 5 years ago she was on 20 tablets a day. She was in treatment. She was in a position where she thought she wanted to die because she thought there was nothing anybody could do for her. And actually that's what she felt like she'd been told by our services, by the psychiatric services which she was receiving. And she was in crisis, which is the lowest point you can get to. She came across a leaflet for art, doing some art classes as part of Creative Minds, and decided to pick it up. And she'd never done art before, but decided to go and do art therapy. She found that, you know, by doing some art classes, therapy happens along the way, is the phrase that she uses, and she found out she was really good at it. And subsequently, she has had some exhibitions at Canary Wharf. She's had exhibitions in Wakefield and Leeds and in the States. She sold over 100 paintings. She's now off medication. She's out of treatment, and she's working in the same trust that the psychiatrist who told her she'll never works, and she says hello to him nearly every day. And what she does very well, I think, is remind us of the assets that people bring to our services if only we would look for them, and if we embrace them, what we can do is create new and better services that deliver huge improvements in the care and treatment of people. I'm going to hand back to Becky now to talk about co-producing.
So this is a program that Rob and I were involved with many years ago now, probably 5 years ago, where we were trying to see whether you could actually co-produce services across a big geographical area. Everyone says you can co-produce if it's just with one person, or you can co-produce if it's just with, with a team, and you might be able to co-produce a service. And we didn't believe that, actually. We think actually everyone says you can't do co-production at any level of scale, and I just think that's because people are scared. So we said we'd have a go, and we were trying to think, well, what was the issue in Leeds that we most wanted to make a difference to? And it was a group of us who were in a learning community together. And we decided on drug and alcohol in the city because we knew at the time that we were sort of lagging behind in Leeds, particularly compared to Liverpool, but that the health and social care system wasn't being honourable about recognising that it wasn't as good as it could be. So it was probably just terrified about having to change, and I think that's a real problem for professionals. One of my friends, Diane Plamping, talks about the sort of core design principles of the NHS, and these are just a couple of them, but one of them, and the foundings of the NHS was can do, should do, and doing means treatment. And I think that underpins the way the NHS is organised, because that's primarily a medical model, and was absolutely fine at the inception of the NHS when we thought there was finite need and you could just fix things and everybody would be jolly and happy together. That isn't the sorts of problems we have now. But of course, we have these value sets that really have struggled to move out of that domain. So we thought that drug and alcohol services in Leeds were in the can do, should do, and should do meant treatment model. It was a very medicalised model. And those professionals, who were fabulous people, couldn't think or see a way of doing it better, and were mortified, to be perfectly honest, that we were suggesting anything different. So the backlash came immediately, which was, who are you to say we can do anything? And at this time, it was, Rob was in the community trust, John was in the PCT, we had some folks in social care, myself in Leeds University at the time, and some folks who were citizens who were activists, is probably the best way of putting it, a sort of Ali Cameron equivalent in Leeds. And we got together and said, we could use the authority of one of those hierarchical organisations, but we don't want to. We want to use the fact that we are also citizens of Leeds, and that as citizens of Leeds, we want to make a difference together. So we're not going to brand it and badge it as belonging to any particular organisation. We're going to call it Co Producing Leeds, and we're going to run it. We're going to run this process in an accessible a way as possible. So we worked with some colleagues who were ex-offenders, who knew where to find people who had drug and alcohol dependencies in the city. And we asked them to go find folks who would be willing to take part in a conversation about how do we do this better together. And the premise was that if we did it better together, then both citizens would benefit, but so would health professionals. It would be a much more satisfying job if you could improve both the nature of the services, but also people's needs around drug and alcohol services. If we could do that better together, everyone would benefit. And so it was a real in it together, win-win all round. Anyway, these folk went and found, of course, masses of people who've got drug and alcohol problems. And when we were challenged at the very early outset about, so why have you picked drug and alcohol? And I said, well, because we're sort of stepping over people in the street on the way to work. You can't deny this is an issue in our city. And we know that other people are doing it better. It led to a deputation from the health system in a very small room in my department at the time. We said, well, if you've got a problem with it, come and talk to us about it. And the room was rammed. And we said, drug and alcohol is really not very high up on anybody's priority list. So we thought making it visible would make it higher on people's priority list. And surely that would be something you'd want to do, because we know you've been battling away to get it on people's priority list for some time. So you know, we were sort of assuming you'd be behind us on this. And it was a difficult one for folks to back away from, because of course it is an absolute shared purpose. But it was, you know, honourably, people were quite scared about what that meant. And there was a level of sense that I will have to give up power if we're going to change. And actually, I'm not sure I'm committed enough to it. We ended up with an event for 200 people in the town hall. We chose the town hall in Leeds because it belongs to the people of Leeds. So symbolically, it's absolutely where, you know, it's owned by citizens of Leeds. And we ran it in a way that ensured that everybody could have a voice. So we spent 3 months designing it and 3 months inviting people to it. We wanted to make sure, we wanted it to be fully co-produced in that we weren't, so what happens when you try and run events like this? Sorry, Rob, but all the tops think they have to be there. You know, they think that it's, you know, because how on earth will people cope if I'm not? So the danger was that we'd be overrun by people at the top of the system, and we wouldn't have anywhere near enough citizens, and we wouldn't have anywhere near enough middles and frontline folk. So we went for 200, because when we started adding the invite list up to get 50% service users and citizens and carers, then we've got to 100 and something invite list. So that made it a 200 people event. Because of course there's faith groups, there's police, there's you know, it had to be a very rich environment. So what we know about co-production is you have to have diversity, and you have to have what we call the system in the room, i.e. everybody who has a say, who can say yes or no to any part of the drug and alcohol service and system. We had to have those folks in the room. And those folks come not as representatives, but to speak their own truths. So we said to everyone, you're not coming here to talk on behalf of anybody else, you're coming here to talk on your own, you tell your own story. And we started off with stories. We also started off with Tender Police. We were going to run an event with 100 people who've got drug and alcohol dependency in Leeds. So, you know, we had to sort of keep the perimeters of the event somewhat safe for folks. But we put in a small cafe area for anybody that was being distressed or was struggling, and we put in quite a lot of pastoral care, and that was intended for both, to be honest, for both professionals and for citizens. Because once you see the system in the room, and you as a hard-working professional think you're doing a fab job, and then you see that actually it isn't working for some people, and when you see citizens who are distressed and challenged themselves, you know, you need space that enables people to be cared for. So it had to be a caring environment. And we started with stories, and we asked people to sit in groups of 3s or 4s from different backgrounds. And there were some telling moments. There was a moment where we asked somebody from one part of the sector to come and sit with citizens, and they said, because they're not come to me, and it was, you know, it was a top. And you thought, well, that sort of says it all, really. So we started off with everybody having a voice, everybody telling stories, and we began to build up to some sense of, so, you know, why don't we try and do more of what's working rather than keep trying to fix what wasn't working? And what was working was things like peer mentoring, but it was very, very small. And there were masses and masses of really small things working, but nothing was joined together. So at the end of the event, we asked folks to come back who are interested in doing something. And 70 people came back from that 200 first off. And 70 people came up to the University of Leeds, some of them never being in a university in their lives before, for a big lunch. And I think one of the principles of co-production is you have to know people socially. You have to know people as people. So we think eating really matters, and lunches really help. And there was a point during the course of the first lunch where John, who was one of our citizens with high dependency, just said, will you stop apologising, all of you that come from the system, from the health system. We know we're a nightmare to work with. Stop pretending that it's all easy and that you've failed. And he said, this is ridiculous. He said, none of us know how to do this better. We have to work it out. And what we did was people went together on learning journeys to find out what was going on in the rest of the country. So we had a drug worker, a GP, and a homeless guy went off to Bromley by boat, for instance. And they travelled together as ambassadors for Co-Producing Leeds. They visited, they came back with their story, and they came back with their ideas. And what stuck was not what we thought at the end of the first event. The first event surfaced principles, relationships. Some things got killed stone dead because, you know, somebody from a hierarchy Sometimes it was a counsellor, took over a group and told them what to do. But no matter, we struggled in that first 6 months with some things failing and some things working. But the things that stuck were fascinating. So there's an amazing group called All Together Better, who have a fantastic practice and citizen champions program. They managed, as a result of this whole effort, to bid for millions of lottery funding, and have now managed to spread that work to the northeast, to other parts of Yorkshire and to parts of London now. So some big efforts came out of it. There's a GP practice in Leeds, and this is hard graft of what takes and how long it takes. So GP practice in Leeds now working as an asset-based model with a number of third sectors, really changing the nature of how they manage, really developing a new model of primary care. There's another one in Pudsey that most people know about, I think, which is Robin Lane. So there was then some team-based things. And then we had some commissioners of drug and alcohol services there who were lurking, to be perfectly honest. They were a bit terrified of the whole thing. And over time, they realised that actually what the citizens, particularly people with drug and alcohol dependency, were saying was that you try and treat us all the same. There are some of us that want to recover. There are some of us that want to work, but on a level of drug use, and there are some of us that want to kill ourselves with it. And you're not differentiating the service, and you're not helping us help each other. You are creating a model of dependency where some of us, even those who are users, can support other people. We want to give something. Being dependent the whole time is not humane. And so we ran some localised events in the city. And I remember in East Leeds, a lady from Gipton, and I can't do an East Leeds accent, but she stood up after a little while of this. These events had around 60 people at them, similar process. And she said, I've just sat next to somebody who's a drug user. She said, I've never met one before. I always thought they were trouble. She said, he's going to come and cut my grass tomorrow. And it turns out, she said, that he's got all sorts of time on his hands that I could help with. And this level, if you look at this slide about what, this is a change of attitude, a change of relationship, that people started discovering a level of reciprocity that wasn't convened through any professional. And so what happened was the entirety of drug and alcohol services in Leeds were recommissioned based on a model both around trying to differentiate services, but also around understanding the nature of the need. So we have some older people in parts of the city who have a very significant alcohol problem. They're very different from our young drug users, and they're very different from some of our Asian communities where it's completely hidden. We needed a much more differentiated services. So what happened was that we supported an absolute a real mixed bag of initiatives across the city. And this is what's interesting is where it's led. So it generates a level of resilience, including some lovely stories for individuals. So people saying that they made friends, that they friends across spectrums and have stayed friends. I've certainly made some friends for years in Leeds as a result of doing this work. Putting a bit of your neck on the line and being absolutely open and honest has been fabulous. So one of the things, this is the story of Co-Producing Leeds, but one of the things that came out of it that was fascinating was, I think, a level of resilience in the system. So I've got here, you'll see it on the slides I'm recording, sorry, let's go back one, the whole story of Co-Producing Leeds. And I've put up on the link there, there's an impact review. But I was talking to people again recently about the impact of this. So you think this is 5 years old. And I don't know if any of you were in the news and saw the tent city in Leeds. So these are 80 people camped out on the Grove. That's that top left picture. These folks, it was just before our Olympians came back for their medal ceremony, so it was a bit of a stir. What were 80 people, homeless people, doing camped out on the Grove in Leeds? And Tom Riddens, our fabulous local authority chief exec, and he worked with these folks and provided some green space for them. But how these folks got rehoused was as a result of citizen leaders who had emerged through the Co-Producing Leeds process, who have taken a fantastic leadership role in the city. They're peer mentors, they support other peer mentors, and those folks went in and started working with these folks who are camped out here, with the services that we'd all got to know and love, and they rehoused everybody that wanted to be rehoused within the space of 2 weeks. Now, I think that was absolutely absolutely stunning. And that wasn't led by any health or social care service. It was led by folks who've been there themselves. And those folks have learned to be confident individuals, to have a say, to work in partnership, to step into each other. They still took the local authorities to court. I'm not saying they're not activists and they're not angry. Absolutely they are. But everybody had a level of understanding each other's role. And I thought that was absolutely stunning. So that was a legacy moment. So just a little bit about what I think we need to do around co-production. So what I think we saw in Leeds was a process, and I think the scale helped. So every time you do it as a team or an organisation, it's really hard to get to enough people. The NHS likes picking people off and fragmenting them. It's a really good way of control. This meant we were out of control. The health and social care system was out of control. It was a full partner. Now, one of the things we're trying to do in South Bank is to support a network of citizens who are going to be activists. Not people who call themselves patient leaders, not people who call themselves patient voices, none of that. Folk who want to be real activists in their own communities. And I think that one of the things we've got to do is systemically support people to have a voice, because I think it's really interesting that a story like that hasn't spread, and it hasn't spread because it's quite a threat to everyone's identity. So I'm going to pass you back to Rob to tell his side of that story, because I think Rob will have a take about what it was like to be a more legitimate leader in the system. I was just a bit of a noisy academic at the time, so it wasn't quite as, probably as threatening. So can I just pass you back to Rob now, make Rob to finish off our session. Can we hear Rob? Somebody unmute Rob.
Thank
Rob,
you,
you're unmuted. You should be able to speak.
I'm okay now. People hear me okay? Great. So I think Becky's story there is a really great example of, you know, the way that this endures. And it was really interesting for me that in many places, when certain people leave, the work isn't resilient enough to endure. It's about the people who were there at the top. But because this was done in a way which co-produced it across the city, and new leaders emerged who felt they had legitimacy to work together and to not always agree, I think the work persisted. And similar work that I did in Calderdale 10 years or so ago has persisted because it was done in the same way. And I think the last two things I would say really goes back to what the STP is about. So the first is that this is a new type of leadership. We're saying we need a networked view of leadership which doesn't use hierarchical power to tell people what to do. It embraces a shared leadership around an ambition where you can probably always agree what the issues are, and you have to try and create the solutions together. I think the second thing is my lasting memory of the first event was that it was a pretty difficult day. We had over 100 people off the streets, many of whom were dual diagnosis and had partaken of significant amounts of alcohol and drugs before they arrived. And we had a lot of professionals who never met each other, and it was in a very grand space. We're asking lots of tough questions. We had lots of honest conversations. It was quite a difficult day, but probably one of the most fun days I've had. And at the end of the day, there was a group of us sat in Leeds Town Hall, which is enormous, in the main room, which has a stage on it, the biggest organ you've ever seen, and a grand piano on the stage. And we were sitting around a round table having a discussion about what we thought and what we needed to do next to repair some of the relationships and to make sure that the action happened. And as I think it was John Beach was talking, and I became aware of some music playing. It sounded beautiful, flowing classical music. And I thought, that's quite a nice accompaniment to what we're talking about, to calm people down a bit. And there were probably about 12 people around the table. And after a few minutes, we all just stopped talking. We turned around and looked at the stage, and there were 3 people on the stage. 3 people who were absolutely smashed, who'd been drunk most of the day, who were from Central Europe, and who'd engaged in the day in a way which was positive but slightly chaotic. and one of them was playing beautiful classical music from memory while his two friends sat down and watched. And when he finished, we all gave him a massive round of applause, and he came over and he shook all our hands and started to tell us a bit about himself. And at that moment, you know, we were, I think, joined in something which was really quite profound, because he wasn't, you know, a drunk, he wasn't a service user. He was somebody who'd created something incredibly beautiful about all these assets. If you could just look past what your prejudices were, that you would see. And I think that that's what this co-production stuff's all about. It's about a new type of leadership and seeing the assets that are in front of you so that we can be successful together. Thank you. I think we're going to hand over to Paul, who's going to host any questions that people have, conscious we're up against the time a bit.
Thanks for that then, Rob and Becky. It's wonderful presentations from both of you. I'm going to pass over to Dominic, who's been monitoring the chat, and he'll be able to feedback with you with any themes that have come out so far.
And hi everybody, good afternoon. Just a couple of points that I pulled out of the chat box there was Rebecca Dado mentioned about the asset-based community development that says whoever helps to define the problem will always be best placed to help define the solution. I think that's a really good starting point and something that we should be thinking about regularly. Christine Morgan had a question for Rob, which is around how are people with long-terms or enduring health conditions supported? Can they stay with Creative Minds long-term? Something to open that up to. And also Joe McCausland asked a great question, which is, some of us are natural connectors. How might we use that to our collective advantage, I wonder? That's probably more of a broader conversation question.
So just a couple of comments on that. I mean, I think whoever defines the problem can help with the solution is dead right. When we look at the integration agenda in Leeds a few years ago, I was always reminded of the fact we got a group of people together to say, well, what do you want out of what we're trying to do as health and care providers and commissioners? And Michelle, who had MS, stood up and said, look, I only want two things. I want to be able to go to the States, to go to Vegas every year, because that's what I do. And I want to be able to go out on my own and go shopping for handbags, because that's what I love to do too. All the other stuff that you bother me with is secondary to those things. So we always took that sort of test to the work we were doing. You know, does it help Michelle go and buy some handbags, and does it get her to Vegas, and what's the equivalent for the person who's in front of us? So having her and people like her in the room made us think very differently about the agenda. Yes, people can stay with Creative Minds. I think what we're trying to do is make it more part of the mainstream provision that we deliver. It's done through charitable means or our own charity at the moment, rather than commissioned separately. So we need to look at the sustainability of that. I'm getting the hard work from Carol to shut up now. I think we better draw a line.
It's Helen, can you hear me?
Yeah.
Great. Just to say that was an absolutely fantastic session. Rob and Becky, and I'm so glad that we've got that recorded, so that we can watch it again and again and again. So